Hello, everyone, and welcome back to episode 3 of the Higher Mind podcast. I'm your host, Jocelynn Carver. I am 21 from northern Minnesota, and again, I am so excited to be back here with all of you guys. So today we're going to be talking about something that about 70% of people have actually struggled with throughout their lifetime or will struggle with at some point, but no one really wants to talk about, and that is trauma. But before we get into that, I would like to talk about my results from the self-proclaimed experiment that I conducted on myself during the end of the last episode of The Higher Mind, which was in episode 2. We were talking about mindset. And I'm going to just pull up that little picture here for you guys real quick right on the side of the screen. And that was just the routine that I was going to try and follow until I was able to record this episode. And my results were actually pretty stunning. So throughout this last week, I had been trying to follow this schedule as best I could. I had quite a few things pop up that were pretty major, but I decided to continue on anyways and just try and do it the best that I could. So it wasn't perfect. I wasn't following it to an exact T, but I was doing it to the best of my ability. And I think that I did really well. And I think that my brain has become somewhat trained to be okay with doing a lot of these things that I really wasn't okay with doing before. For example, I have been stretching every morning and every single afternoon. I have also been journaling every single morning and every single afternoon. I've been skipping over some of them in the middle of the day just because I've been really struggling with motivation, and I just have really bad self-discipline in general. Of course, I believe that if I tried to continue this and really got good at staying on schedule and staying on task, and I use that self-discipline, I do believe that these new neural pathways would eventually start to create themselves. That is the one thing that I wanted to say was, I think most of this, especially when you're first starting out, it's a lot of self-discipline, and I don't have that. I take it back. I do have it. We all have it. We all have the ability to be disciplined and to discipline our minds, our brains, but it's something that I really struggle with. I have super bad ADHD, and I think I talked about that in the last episode, so that's something that I've struggled with, and it's something that keeps me from being able to do the things that I truly want to do, because it just kind of feels like there's these invisible chains that are just holding me back and holding me down and preventing me from doing the things that I really want to do. But I do think that people with higher motivation and better self-discipline would 100% be able to do this with far more ease than, say, I have been able to. But I am going to persist because our brain is so easily changed, and even if it takes time, I'm willing to put in the time, I'm willing to put in the effort and the energy just to get back into a routine that I feel comfortable doing. Another thing that I have noticed is that it is far easier for me to get myself to get up and either go to the gym or just start working out at home. And that was something that I really struggled with for a super, super long time. So that feels really good and definitely reassuring and shows me that I have made progress and shows me that these new neural pathways are being created slowly but surely. I just have to break down those old ones. But with all of that being said, I think that it is time to move on to trauma. The higher mind. Disclaimer, I'm not a licensed mental health practitioner or a doctor. Everything in the following video/audio file is information from credible articles, books, or teachings I've gathered through my therapist, psychologist, psychiatrist, or group therapies that I found helpful to utilize in my life. Trauma. So, if you aren't already aware, you might be wondering, what is trauma? Trauma is a person's emotional response to a distressing occurrence or situation or experience. And there is a difference between ordinary hardships and then true trauma, which usually trauma is very unexpected, so you can gain trauma from numerous different things, which we will get into later on, but it's not something that everybody experiences, but most people will experience at least one point in their lives. According to this article, about 6 in every 10 men experience trauma at one point in their life, and 5 in 10 women experience trauma at one point in their life. Now, I've seen a ton of different studies posted on this, and there are so many different statistics out there, but it does generally state that about 70% of people do experience trauma in one point or another throughout their lives. And trauma affects everything within a person's life. So I'm actually going to pull up this little link here from Almond Clinics. On this, it states who is affected by PTSD. So approximately 3.5% of US adults suffer from PTSD, which not everyone who goes through a traumatic experience will develop PTSD. Actually, a very small number, about 1 in 7 to 1 in 10 people who experience a trauma will develop PTSD. And an estimated 1 in 11 will be diagnosed with the condition at some point during their lifetime. That's a very large number, though, if you really put it into perspective. 1 out of every 11 people in the US have PTSD or have had PTSD. That's wild. It is believed to affect a higher proportion of veterans, between 11 and 15%, especially those who served in combat areas. However, for Vietnam vets, the lifetime rate of PTSD is closer to 30%, which is similar to the rate seen in first responders. Recently published research has also found that a notable number of healthcare professionals working in hospitals during the peaks of the COVID-19 pandemic developed symptoms of post-traumatic stress disorder, and that is what PTSD is. PTSD can also affect males and females. However, females are 2 to 3 times more likely than males to develop the condition. In addition, girls tend to suffer trauma at a younger age when it has a greater impact on brain development. So, in short, trauma can affect anyone and everyone. There's no single demographic or race or religion or gender that is going to be affected by trauma more than the other. It just depends on experiences and the way that our brains respond to these experiences. But getting back now to the types of trauma, because that is something that I had previously mentioned, there are 3, but technically 4 different types of trauma. There is acute trauma, and this is a single event that has caused you distress or put you in some form of danger. So, for example, if you got into a car accident or you were involved in a robbery, those are 2 things that could give you potentially acute trauma. The next is chronic trauma, and this is repeated exposure to stressful or dangerous events. For example, if you were involved in domestic abuse at some point in your life or bullying at some point in your life, those are both things that could absolutely give you chronic trauma. And then the next one is complex trauma. So if you have complex trauma and you develop PTSD, this will actually be put into the category of C-PTSD, which is complex post-traumatic stress disorder. And this is exposure to multiple different types of traumas. So this could be a combination of different acute traumas and chronic traumas, or one or the other. So for example, you might have been a victim of domestic abuse as well as been in a major car accident. Maybe you were also bullied, and maybe you also went through a sexual assault at some point in your life. So it's anything more than 2 or 3, I believe, different traumas put together that have given you this complex trauma. But there's also system-induced trauma, and I feel like this one can kind of be put into the category of acute, but not necessarily. These are system-related. So, for example, this could be a removal from your home at a young age, or you might be moved into a residential facility. That can absolutely be traumatic. Otherwise, being moved into protective custody, that's traumatic. That's traumatic, even if you hadn't experienced trauma prior to being placed into protective custody. So yes, 3, maybe 4 different types of trauma: acute, chronic, complex, and then system-induced, which could be categorized as other, but it is induced by the system. I had given a couple of examples when I was explaining these different types of trauma on different traumatic experiences that you could go through, but that is just a very limited number of experiences. So I'm going to pull up this sheet that I have created, and this just lists some traumatic experiences, some major traumatic experiences. And like I said, this is not all of them. I don't think that you really could list them all, because trauma shows up differently for everyone, and everyone reacts to experiences in a different way. So what may seem traumatic to someone else may not seem traumatic to you. Also, you never want to judge somebody based on their experience with their trauma or the way that they react to their trauma, because, I don't think that any of us can really truly control that, especially if it's something that happens quick. On this list, I'm just going to go through a couple of them. So first off, we have abandonment, and abandonment can be both emotional or physical, and that one truly can affect anyone at any age, but especially children at a young age. For example, when you were less than 1 year old, that is going to massively impact you for the rest of your life, because your brain actually doubles in size during your first year of life. So trauma during this period is just massive. Next, we also have abuse, and I just put general because there are so many different types of abuse. You could do mental, emotional, physical, sexual. Any type of abuse can absolutely be traumatic. Active combat, accidents, addiction. So even if you went through addiction, that can be traumatic. Or if you were to witness drug abuse from someone who is very close to you that you loved very much. That is absolutely a traumatic experience as well. So we also have any type of neglect. That could be physical or emotional as well. A couple more things that I feel are very important to add would also be chronic symptoms. So if you deal with a chronic or terminal illness, absolutely that can be traumatic. Absolutely. As well as consistent overwhelm. If you are constantly overwhelmed, your brain is going to take that as a trauma response. You're going to be in constant fight, flight, or fawn, and that's trauma. Another one is if you are young and you are going through frequent moves, say you were a military child and you are constantly moving around, your environment is constantly changing, that is traumatic because you're not really finding your sense of self. You're not able to focus on who you are and develop yourself. Next is homelessness. Homelessness can seriously be so traumatic. Not only the experiences that you can go through while being homeless, but just being homeless in general, just the idea of not having a home, not having a place to call your own, that is traumatic. Another one is obviously loss of a loved one or of a pet. Those are both traumatic experiences, or loss of a parent. And this could be not even through death. This could be through divorce or abandonment. That is super traumatic for anyone at any age. And lastly, I'm just going to cover one more: man-made or natural disasters. Very traumatic. I mean, we look over at Gaza and Palestine right now, and it's just absolutely horrid. I can't imagine the trauma that all of these people and all of these survivors are going through right now. But I would like to get into what the effects of trauma are, because I feel that it's very, very important to not only understand, but to be aware of, so that we can actively change these things and get better, because in the end, isn't that what we all want? So I'm now going to pull up another picture that I have created, and this one has a lot of information. Don't feel like you have to read it all, but I am going to go through a lot of it. So this just states how trauma can affect us long term. I want to get into the brain first of all. So like I said, the brain doubles in size in the first year of life. You are actively creating brand new neural pathways. Neurons are being produced at an astronomical rate. And any sort of traumatic experience at that point in your life, like I said, is just going to affect you insanely. But you might be wondering, how does it truly affect the brain? What parts of my brain are being affected? This little portion here up on the top left of this page, and this just shows a picture of a brain. And in the front portion of your brain, this is called the prefrontal cortex. It makes up about 30% of the human brain, which is massive. I mean, you compare that to chimpanzees, and theirs is 11% of their brain. So we have a huge prefrontal cortex. But this is responsible for rational thinking. It also regulates our emotion and our fear responses. And when we go through a traumatic experience and we develop PTSD, that actually reduces the volume of our prefrontal cortex, which is crazy. Another part of the brain that is affected by trauma is the amygdala. So this is right in the lower center of your brain, and it's a small area. This is the part of the brain that is wired for survival, and it is also responsible for our flight, or fawn response as well. And when you have PTSD, there is actually greater hyperactivity here. So for example, if you were to scan the brain of a healthy person and then scan the brain of someone with PTSD, you would see a far greater level of activity there, which would indicate the presence of PTSD. And then lastly, we have the hippocampus, which is right behind the amygdala, and it kind of goes, and this is responsible for memory and differentiating between the past and the present. So very, very important. This part of our brain also remembers trauma and tries to make sense of it, and also shrinks when you're exposed to trauma. So 3 massive parts of your brain that are highly affected by trauma. It's not just something that we can just get over just like that. It's not something that, we wipe our tears from our face and we move on from. It truly affects so many parts of ourselves, including our brain. It also affects our nervous system, our circulatory system, everything. But I'm going to go over to the cognitive effects of trauma. So this can actually lead to hyperarousal of the HPA axis that can result in changes or delays in brain development. So if you're young and you're going through a traumatic experience, or you have PTSD, your HPA axis is going to change, and therefore your brain is going to change, and it's going to result in developmental issues with your brain. PTSD can also cause phobias, mood swings, anxiety, sleep issues or insomnia or fatigue, and difficulty concentrating. It can also create fixed, isolated neural networks that are resistant to change, and these were the neural pathways that I talked about in episode 2. Here's the link if you'd like to watch it. And I also put on there less neuroplasticity. That isn't necessarily true. It just, like I said, is much harder to change because your brain, in a sense, kind of hardens, and it's a little bit harder to gain that neuroplasticity back in those parts of your brain that have been affected by that trauma. Like I said, it affects your amygdala, which can cause you to over or underreact to stressful situations. So, for example, if someone scares you, it might give you an increased fear response. It could distort your self-image, interrupt emotional functioning, and increase your sensitivity to threat perception, which again can be that fight, flight, or fawn response. It can cause difficulty inhibiting negative or unhelpful thought patterns. It can also create destructive impulses. It can cause hypervigilance, increasing wakefulness or anxiety. It can lead to struggles with language development or taking in new information. And it can lead to severe mental health problems or cognitive impairments. And lastly, it can cause a distortion in perception of traumatic events. So, for example, you may not remember it as clearly as you'd think you might remember it in the moment because it feels so big. But your brain is always trying to protect you, and so your brain will kind of inhibit those memories from popping back up into your brain just so you don't have to deal with that trauma again. Moving over to physical effects, this can lead to, like I had already stated, trouble sleeping. It can also lead to gastrointestinal distress. So it's actually proven that you are far more prone to IBS if you were diagnosed with PTSD at some point in your life than other people normally would. It can cause headaches, body aches, pains, and tension. So, for example, our bodies like to hold on to trauma, and we hold that in areas of our body that we hold tension in during those experiences. So when I am stretching, I like to really focus on those areas, and a lot of times when you release that tension, a lot of emotions can actually come out. For those of you that don't know, I was a massage therapist for a little bit over a year, and I ended up having to quit because of management, unfortunately, but I learned a lot while I was there, and I did have many experiences where a certain point of tension would be released, and there came the emotional release as well. And then previously I talked about IBS, but this just says that it could lead survivors to have a 3 times higher likelihood of developing IBS, chronic pain, fibromyalgia, and chronic fatigue syndrome. But luckily, there are so many different forms of treatment that are available to us. Unfortunately, there's no immediate fix, but there are some different ways that we can absolutely help ourselves and help our brain get healthy again. So the first one that I have written down is psychotherapy, and there are numerous different types of psychotherapy that you can utilize, such as TFCBT, which is trauma-focused cognitive behavioral therapy, and this is wonderful. Even if you just look into CBT, which is over on the right portion of the forms of treatment. There is also somatic therapy, which is focusing on the connection between the mind and the body. So like I was talking about originally, you hold this tension in your body from these traumatic experiences. So you're focusing on that during somatic therapy. There's also psychodynamic therapy, which focuses more so on the unconscious processes that influence your thoughts and your behaviors. And then there's another one called EMDR, and EMDR is actually something that I am in currently, and I absolutely love, and it is so powerful. I never would have been able to comprehend the power that it would hold until I started doing it, but this is eye movement desensitization and reprocessing therapy, and it is wonderful. When we're sleeping, we go through REM sleep, and this is rapid eye movement, and our eyes kind of dart back and forth, back and forth, back and forth, and this is one of the only times that we actually are able to subconsciously or unconsciously process through trauma, because as we sleep and we're going through this REM sleep, our brains are trying to map out and figure out exactly what had happened and then shove it into different areas of our brain for storage. And a lot of times when we go through a large traumatic experience, or we go through numerous traumatic experiences in a row, our brain doesn't have the capacity to be able to process that all at once. So it kind of holds it right in the back of the brain, and it's just stuck there. So in EMDR, you are using either tapping sensations on your shoulders or your knees, or you are following the therapist's fingers back and forth. Otherwise, they also have audio versions where it's beeping back and forth. That's the one that I do. And as you go through that, you are just reprocessing and you are kind of replicating that REM sleep pattern that you would be while you were sleeping. Next one is neurofeedback treatment. And this is where patients are taught to control brainwaves. And I don't know a ton about this one, but I have heard some fantastic things about it. I already talked about CBT therapy. And then we also have CPT, which is cognitive processing therapy. Cognitive therapy, which is just a very broad version of CPT, CBD, and TFCBT. And lastly, we have narrative exposure therapy. So this one is focused more on establishing a clear life narrative to contextualize traumatic experiences. So to see it in more of a story format rather than a part of you and something that had happened to you, it's a story and it can be explained. We also have more holistic forms of treatment, such as body-oriented methods like yoga, mindfulness, and exercise or movement, which can actually repair the nervous system. There's also prolonged exposure, which is gradually confronting traumas to gain control over thoughts and feelings. And this one is difficult, especially for people who have gone through exposure therapy. Prolonging that process is very, very difficult, and it's hard to get through, but it is so worth it in the end because you are actively working on desensitizing yourself to that trauma and removing yourself from that trauma. It is not a part of you anymore, but it did happen to you in the past. Lastly, there is also medication, and the medications are very limited for PTSD, but they will usually put you on an antidepressant if you're struggling with depression or anxiety. So a lot of those are like Zoloft and Lexapro and Prozac. So just for a quick recap, trauma is far more than just the way that we view reality and the way that we react to reality or our current experiences. It affects everything. It affects our sleep and our nervous system and our brain and everything. And if you are currently on your own path to recovery right now and you're feeling as though a certain type of treatment is not working for you, absolutely, I urge you to try something new because there are so many options out there and I don't even have half of them listed. Being able to find the correct treatment type that works for you is so, so important because just how trauma is a personalized experience, it's different for everybody. So is treatment and so are medications. So when I was first starting out being medicated for my symptoms of both PTSD and depression and anxiety, I was terrified to even start my first dosage. I was horrified. I had heard so many horrible things about side effects and symptoms that you could have from these medications. And the first medication that I ever went on, which was Lexapro, absolutely changed my life. I don't think that I would be here today without Lexapro. It truly helped me in astronomical ways. Unfortunately, after about a year and a half of being on it on the highest dosage that they're allowed to prescribe, it just suddenly stopped working for me. And at the time I was terrified and I didn't know what to do. I didn't know if I should switch over to a new medication or if I should just try and wait it out. But in the end, I was transferred over to a new psychiatrist and we decided to try out a new antidepressant. At the time, I remember thinking that I was a failure or that I had done something wrong because this one medication wasn't working for me, or that I was absolutely hopeless and helpless because it wasn't working anymore. But that's absolutely not the case. I like to think of it now as the way that Dr. Almond puts it. There's nothing wrong with you. Your brain is just different. So for someone who needs glasses, that doesn't mean that there's something wrong with them. Their eyes are just different, so they try on a pair of glasses, and sometimes the prescription isn't correct, and so they have to make a slight change to that prescription and give you a new one, give you a higher prescription or a lower prescription, or completely change it up altogether. And that's exactly what we're doing with both medication and treatment. And just to go back to what I was saying, I have started a new antidepressant. I went through a couple that didn't work for me, but now I'm on one that works wonderfully, just as well as Lexapro had for me, and I love it and I couldn't be happier. It's just very stressful in the moment, but we have to sit and remind ourselves that there's nothing wrong with us. We didn't do anything to deserve this. It's just how our brains work, and we just have differences. Staying on topic with the brain for a moment, I had also mentioned that if you were to get an MRI or a CAT scan of your brain with PTSD, it would look far different than that of a person with a healthy brain scan. I'm actually going to pull up a visual for you. This is a SPECT scan from Almond Clinics. This is the man that I keep referencing, but he did a scan on a healthy brain. So here you can see a massive difference right from the get-go. So the lighter spots on the brain are where the most activity is occurring. So you can see here that the back of the brain on a healthy brain scan has far more activity in the back of the brain than on the PTSD brain. And according to Dr. Amen, he says that a dead giveaway for post-traumatic stress disorder brain is this diamond shapes in the prefrontal cortex here. So we're seeing a lot of activity in the prefrontal cortex as well as the middle parts of the brain going back into this little diamond shape where there really isn't very much activity in the healthy brain. So massive differences. I would now like to move over to my personal experience with dealing with my diagnosis of PTSD, which was a tough one. I personally do not believe that there is anything wrong with people who do not have access to mental health care to try and self-diagnose. I think that that is one of their only options that they have available at times, and for me that was one of the only options that I had available for a while. So for a long time I was looking at my absolute list of symptoms and I was just overwhelming myself and wondering what in the world could be wrong with me. And I was looking through the DSM book, which is what they use to diagnose people now in 2023 with mental illnesses. I was noticing that my symptoms were lining up with an absurd amount of diagnoses that really didn't truly fit me or what I thought I could potentially have. So I would just like to go through some hidden symptoms that people don't really talk about with C-PTSD, which is what I have. So looking at this little diagram that I have made, there are so many different hidden symptoms that really aren't talked about until you really dive deep and look into them yourself. So I just want to inform everyone and let you know that even if you have a list of symptoms that you are struggling with, it doesn't mean that you have 20 different things that are wrong with you. It only means that you have numerous different symptoms, and a lot of times these can all come from PTSD or trauma. So going through this list, you can have heart palpitations or periods of racing heart. And I thought this was just my anxiety for a long time. I recognize now that no, it was absolutely a trauma response. I would feel a trigger from something and my heart would start racing out of nowhere. And oftentimes I wouldn't understand why until I started to recognize what my triggers were and I was able to pinpoint why I was feeling these certain symptoms. Another one is feelings of insatiable boredom. I had thought this was because of my ADHD, and maybe partially it is, but you just feel so bored and highly uninterested in doing things. Another that I have already said previously was exaggerated startle response. This can be due to your fight, flight, or fawn response. You also might be living out fictional stories in your head at night. This is something that I do. These can be very positive stories most of the time, so you might envision yourself being in a place where you want to be or with people that you dream to be around. And this is totally normal if you have PTSD. It is your brain's way of trying to find happiness in all of this. You could also experience sharp or sudden pains that make it feel as though it's hard to breathe, and this is often due to hypervigilance or high constant anxiety. So I used to, for example, feel it right in my heart or right below my left breast, and it was just so intense and scary. There were numerous times where I felt I had to go to the hospital because of this, but I recognize now that it was because of my C-PTSD, and I was in a constant state of fight or flight, so my anxiety was just so high. I was always just massively hypervigilant, and I'm not a doctor, so I'm not telling you that if you're experiencing this, don't go to a hospital. Absolutely, if you're concerned, reach out for help. This is what that was for me. You also might struggle to fall asleep because your mind is absolutely racing, and a lot of this does come from anxiety. You might also feel inexplicably guilty or shameful. That was a tongue twister. You could experience flashbacks, or you could relive vivid memories. You could also engage in risk-taking behavior, or you could have difficulty remembering major events or something that has recently occurred. And again, this is your brain's way of protecting you. Sometimes it just filters it out wrong, and you might not remember some positive events. You could also have poor judgment, or you could react without thinking things through. So this is a lot of reacting with your emotional brain rather than your logical biological brain, and we talk a lot about that in episode 2 as well, and trying to use wise mind, which is a combination of those two things. You might feel hopeless, you might feel dissociation, or sometimes depersonalization, and this is a horrifying feeling, especially for people who haven't experienced it before. It is the feeling of not being in control of your body or in control of your words. You might feel as though you are looking at life through a camera, or like you are watching yourself in third person. And this is another way of your brain protecting yourself. You could also experience a lack of emotion. You could have difficulty trusting others. You could have very poor self-esteem or a very negative self-image. And you can also have difficulty concentrating. So when I was going through my diagnosis with ADHD, we had to go through numerous different tests just to make sure that it wasn't just C-PTSD and all of its symptoms, because they are so broad and so vast. Another hidden symptom that I hadn't written down because I just wanted to talk more about that personally. As I was growing up, I had experienced trauma numerous times from a very, very young age. And I remember at about 7 to 9 years old, I started to feel very disconnected from my peers or from people that were close to my age. And I noticed that I would get along far better with children that were a few years older than me, or adults even, and I would be able to have massively mature conversations with people that I don't think that most 7 or 8 year olds would normally have with people. And before I truly started looking into trauma and all of its symptoms that it can hold, I always felt as though I had just matured very, very quickly, and I wasn't exactly sure why. I had first hit puberty when I was 9 years old, and I got my period when I was 11 years old, which in my opinion, are fairly young compared to a lot of the girls that were my age that I was close with. But I did find this study from APA.org, and this says that experiencing childhood trauma makes the body and the brain age faster. And I think that for me, I kind of just assumed that I had to mature far faster than other children my age due to my trauma, because I had these expectations that were upheld of me that were far beyond what I should have been having to do at that age than other children were. And so I kind of assumed that I had just matured quicker than others from what I had been taught. And I believe that that is partially the case, but I do want to read a little bit of this article to you. It says that children who suffer trauma from abuse or violence early in life show biological signs of aging faster than children who have never experienced adversity, according to research published by the American Psychological Association. The study examined 3 different signs of biological aging: early puberty, cellular aging, and changes in brain structure, and found that trauma exposure was associated with all 3 of those things. So not only is trauma affecting your maturity level, but it is biologically changing you. Exposure to adversity in childhood is a powerful predictor of health outcomes later in life, not only mental health outcomes like depression and anxiety, but also physical health outcomes like cardiovascular disease, diabetes, and cancer. Our study suggests that experiencing violence can make the body age more quickly at a biological level, which might help to explain that connection. Previous research found mixed evidence on whether childhood adversity is always linked to accelerated aging. However, those studies looked at many different types of adversity. They looked at abuse, neglect, poverty, and more, and at several different measures of biological aging. To disentangle these results, McLaughlin and her colleagues decided to look separately at 2 different categories of adversity: threat-related adversity, such as abuse and violence, and deprivation-related adversity, such as physical or emotional neglect or poverty. So instead of studying a very broad group of children, they decided to instead look at 2 very specific groups to hopefully narrow down their results. The researchers performed a meta-analysis of almost 80 studies with more than 116,000 total participants. They found that children who suffered threat-related trauma, such as violence or abuse, were more likely to enter puberty early and also showed signs of accelerated aging on a cellular level, including shortened telomeres, the protective caps at the end of our strands of DNA that wear down as we age. However, children who experienced poverty or neglect did not show either of those signs of early aging. In a second analysis, McLaughlin and her colleagues systematically reviewed 25 studies with more than 3,253 participants that examined how early life adversity affects the brain development. They found that adversity was associated with reduced cortical thickness, a sign of aging because the cortex thins as people age. However, different types of adversity were associated with cortisol thinning and different parts of the brain. Trauma and violence were associated with thinning in the ventromedial prefrontal cortex, which is involved in social and emotional processing, while deprivation was more associated with thinning of the frontoparietal default mode and visual networks, which are involved in sensory and cognitive processing. I'd like to jump over to this article from the Harvard Gazette, which says that they found that violent or traumatic experiences led to accelerations in pubertal development, brain development, and cellular aging, while neglect and chronic poverty did not, though they can affect physical and cognitive development in other ways. So these studies just proved that trauma absolutely affects more than just our responses to experiences in our lives. It affects our brain, it affects our development, especially when we experience it at such a young age. And with that being said, if you experience trauma at a young age, you are more likely to experience regression later on in life. And regression is an interesting topic that I would love to cover because I do feel as though it is something very important and something that I don't think enough people talk about. So regression actually comes from arrested psychological development, and this is the stoppage of physical development, emotional development, or mental development before reaching adulthood. And when you experience arrested development, a lot of times you're going to experience regression later on in life. And regression, according to this article, says that regression is an unconscious defense mechanism which causes the temporary or long-term reversion of the ego to an earlier stage in development instead of handling unacceptable impulses in a more adult manner. So we all have different parts within ourselves. We have our infant self, our toddler self, all the way up to our adult self. And each of these parts plays an integral role into who we are now and how we react to certain situations. And if we aren't able to heal these hurt parts of our past selves, they're going to affect us in life now. So regression is typical in normal childhood, and it can be caused by stress, frustration, or by a traumatic event. Children often manifest regressive behavior to communicate their distress. Addressing the underlying unmet need in the child usually corrects the regressive behavior. So, for example, if you have a 4-year-old and they begin to use baby talk when they are frustrated or upset, that is regression, and that is absolutely normal. They're just trying to communicate what they need or want in a way that feels comfortable for them. But regression in adults can arise at any age. It entails retreating to an earlier developmental stage, emotionally, socially, or behaviorally. Insecurity, fear, and anger can cause an adult to regress. In essence, individuals revert to a point in their development when they felt safer and when stress was non-existent, or when an all-powerful parent or another adult would have rescued them. Regressive behavior can be simple or complex, harmful or harmless to the individual showing the behavior and to those around them. Regression becomes problematic, especially in a hospital, when it is employed to avoid difficult adult situations or stressors. But looking at the way that regression can manifest itself gives me a much higher understanding of what regression really is. And I'm just going to say that before we get into these different manifestations, please be aware of the fact that these people who experience regression have no control over this. And not only that, but we need to be very non-judgmental and remember that we have no idea who uses these coping mechanisms, and to judge would be to hurt. So here are a couple of manifestations of regression. We have engaging in quiet baby talk. So say you were traumatized at a very young age and you are now an adult. It might be safe and comforting to talk like a baby when you feel you need or want something, and you might regress back into that safe stage of your life. Another one is being incontinent of feces or urine, so feeling as though you cannot control your continence. You are going back to the infancy stage or the toddler stage of life, and this is just when you felt most comfortable. Another one might be crying or sucking on objects or body parts. Another could be masturbating, whining, being mute, needing a comfort object like a stuffed animal, playing possum or playing dumb. You might be physically aggressive, and this comes more from the toddler stage. You might assume the fetal position. You could be rocking, pacing, having temper tantrums, or engage in bedwetting. And like I said, this all happens subconsciously. It's something that is very, very hard to control, and it's very hard to recognize as you're doing it because it is your brain's way of protecting you and bringing you back to where you felt safe and comfortable. So this is actually just more proof of the fact that our body and our minds are far more related to each other than we may have originally thought. I'm going to pull up this article from Psychology Today that I absolutely love, and I think that it really helps me to understand the connection between the two. So when you get stuck, your amygdala, the primary culprit in the fight or flight response, which we had covered earlier, gets really, really sensitive. If you've ever seen a deer in the wild, you've seen the amygdala at work. This part of your brain screams, "Get out," when it feels that you are in danger. Your brain stops processing and focuses all of its energy in getting you away from danger. I don't necessarily like the idea of the deer in the wild. I would rather, since I live in Minnesota, I would say probably a bear if I were to see a grizzly bear out in the woods. So this memory doesn't get fully processed, and it is fragmented in the brain in chunks of implicit and explicit memories. This is why sometimes a smell, the way a person touches you, or even a tone of voice can trigger a trauma victim. But here's the problem, and this is very important. Your body cannot tell the difference between physical and emotional danger. This is the reason that you have a fight or flight response to stimuli, whether it is emotional or physical. Your brain, the very primal part of your brain involved here, thinks that you are in physical danger, which is why you have the physical symptoms. So we need to address the physical in order to solve the problem. The issue is twofold. We need to bring the body's response down, calm down the hormonal messengers who are telling you that you are in danger, and then you can work on the mental and emotional aspects of this trauma. Otherwise, you're just setting yourself up for failure. And it says right here that so the next time that you are struggling with healing from your trauma, remind yourself that your body is doing exactly what it's supposed to do. It's doing what it thinks is protecting you. And you just need to work on recalibrating that alarm system. So your brain and your body are so very connected, and the way that trauma manifests is often in a very physical form, such as fight or flight, or in some cases, regression. With the physical aspect of trauma in mind, I would like to move over to generational and intergenerational trauma. And there is quite a big difference between those two things, and sometimes intergenerational and transgenerational are used interchangeably, and that's fine, they're about the same things. But assuming that we are looking at the physical side, aka the biological side, we can notice that generational trauma absolutely can affect younger generations from that same family. For example, when your grandmother became pregnant with your mother was carrying all of the eggs that she would have throughout her lifetime, including you. And say your grandmother were to go through a traumatic experience while pregnant with your mom. All of that genetic information and those genomes are going to absolutely affect your mother, and therefore you and your biology, because you were technically inside of your grandmother at one point. So at one point or another, you all shared the exact same biological environment. And so this can actually be related to intergenerational trauma. And intergenerational trauma is trauma that is shared by different generations, while generational trauma is trauma that is passed down from one generation to the next. So from grandma to mom to yourself now. But I would like to talk a little bit about transgenerational trauma and just how much that could potentially affect you, even if you don't know it yet. So I'm going to pull up this article from Psychology Today, and this is from Breaking the Chains of Generational Trauma. It states that transgenerational trauma refers to a type of trauma that does not end with the individual. Instead, it lingers and gnaws through one generation to the next. So families with a history of unresolved trauma, depression, anxiety, and addiction may continue to pass maladaptive coping strategies and distrustful views of life onto future generations. So rather than biological, these might be negative coping skills that are passed on. In this way, one can repeat the same patterns and attitudes of former generations, regardless of whether or not they are healthy or regardless of whether or not they have experienced this trauma. It also states that when parents live under oppressive circumstances, for example, they can develop survival messages. So they might think, don't ask for help, it's dangerous, because they might have been in a situation where it was dangerous to ask for help. That may be taught and passed on from one generation to the next. While these messages may have helped protect earlier generations, they can cause later generations to have a fearful and distrustful outlook on life and towards helping professionals, further alienating the support that is needed to overcome the aftermath of the trauma itself. In addition, researchers are also exploring how the body itself may serve as a vehicle through epigenetics, and that's something that I would absolutely love to get into. Moving over to an article from Insider, this says that most obviously, negative cycles of abuse can lead to repeated traumas from generation to generation. This is transgenerational trauma. For instance, parents may think physical abuse is the best way to parent their child, King says, but ultimately it contributes to intergenerational trauma. Moreover, if parents have unresolved traumas, they may develop negative coping mechanisms that they pass on to their children. For example, one 2015 study suggests that survivors from a Ukrainian genocide were likely to experience feelings of anxiety and fear and to adopt behaviors like hoarding food. Their children and grandchildren later adopted some of these negative coping strategies and fears. So for their generation, it was necessary to hoard these foods because they weren't sure if they would have these things in the future. And I've seen this in my own family. I have family members who went through the Great Depression, and so to this day, they still have that same thought process of keep everything because you may need it in the future and use absolutely everything to its limits, which I can absolutely understand. But it can harm those who come in later generations and make them fearful and anxious of the future and fearful and anxious of not having enough to get by. The way that trauma spreads can be more subtle as well. Parents who have experienced traumas can struggle to develop positive attachments with their children, and they may have issues anticipating their kids' wants and needs. Though this lack of bonding isn't necessarily as obvious as physical abuse, it can cause mental health and interpersonal issues for children in the future, like an inability to be vulnerable and to trust future partners. So like I stated previously, that all includes a lot of trans or intergenerational trauma, but I want to get into some of mine just to give you a little bit of a personal perspective. Of course, communication is key when it comes to generational trauma and learning about generations before you that have experienced trauma and how that could be genetically passed down to you. And I can't remember exactly where I had read this, but there was also a study done on sperm count, and they tested the sperm of different males who had experienced trauma and different males who had not experienced trauma, and the differences between the two were massive, absolutely extraordinary. So not only is generational trauma passed down from maternal grandmother to mom to yourself, but also from the paternal side of things through sperm. So just to stay on the transgenerational topic for a moment, I would like to give a personal account of some of my transgenerational trauma that I have experienced. So obviously it's very hard to tell when we do have generational trauma because it's a part of our DNA, it's a part of our genetics. But with transgenerational trauma, it's completely different. It's something that is pushed upon us by the beliefs and the teachings of those who have experienced trauma before us. Right now, at this stage in my life, I do not want kids. But I obviously have thought about if I ever were to have kids, how I would want to raise them. And in all honesty, it's far different than the way that I was raised and the way that my parents were raised. And this has nothing to do with me holding any animosity towards how my parents raised me. I truly feel as though my parents did their absolute best with what they had available to them, with the way that they were raised and the way that their brains work. But with that being said, knowing the way that I would like to raise my potential future kids have all come from ways in which I do not want to raise my kids, which were some of the ways that I had been raised. So in episode 1, which has now been removed, I had explained my relationship with my biological father growing up until I was around 12 years old, and it was absolutely phenomenal. We were very open with each other. We talked a lot. We were able to express our feelings and our emotions openly, and there was no judgment. And for that, I was unbelievably lucky, and I am still unbelievably grateful for all of those years. But as I got older, I believe that my dad and I are very, very similar. And with that being said, we butted heads a lot. And I think that for a long time, his coping mechanisms and his coping skills were working for me. And so if I would come to him with a problem or an issue, he would direct me in a way that had helped him in the past. And most of the time, it absolutely worked for me. But I changed a lot from 12 to 14, and during that period, my father and I's relationship also changed a lot. And I hadn't really recognized it at the time, but now looking back, I can absolutely see where that transgenerational trauma was starting to peek its head in. The way that my parents and my grandparents had been raised was far different than I had been when up until I was 12 years old. And they had been raised in a be seen and not heard type of environment where it wasn't very normal to talk about your feelings and to openly express your emotions. And I believe that when my emotions began to evolve and I began to experience far greater symptoms of depression and anxiety and PTSD, I think that what I needed to cope and to problem solve was far different than what I had needed when I was younger and what my father had used and had worked for him. So very soon after age 12, our conversations massively dwindled, and unfortunately, showing emotion and expressing feelings was seen much differently than it had been previously. It was no longer open and vulnerable and emotional. And after a certain point in my life, I had not been taught how to regulate my emotions or my responses to external stimuli. So a lot of this transgenerational trauma started showing up when my emotions became far more difficult to handle for both myself and my parents. There were positive and negative emotions, and any negative emotions were deemed extremely negative. You weren't to cry, you weren't to express any aversion to the parenting techniques. And like I had said previously, I don't blame them for raising me the way that they did, because they had been raised that way and that was what was deemed as normal and right for them. And it was the same way for coping mechanisms as well. It was, you do this to get better, and that is what has worked for me and my parents, so it needs to work for you. And if it didn't, it was wrong and I had done something wrong. Another big part of this transgenerational trauma that has very recently popped up was the beginning of this podcast, and I had explained a little bit in episode 2 why the first episode was removed, but I had received a lot of negative feedback from family members that I had talked openly about. I didn't say any names and I didn't give any specifics, but one thing that I have noticed now is that there is a large belief that what happens in the family stays in the family, and to make these things public is to speak negatively on the family's name, and that's absolutely not what I was going for. I'm just trying to tell my story and hopefully help others in the process. So generational trauma can show up in a number of different ways, and it's mostly through learned behavior and how your parents and your grandparents were raised. And of course, trauma is trauma, and that is absolutely valid in and of itself, but I like to look at the positives because it helps me to feel more connected with myself and with the people that I absolutely love and know to be good people, but good people do wrong sometimes, and that's okay. So what has helped me most with dealing with this transgenerational trauma is to look at all sides of the story, to recognize that most people have been hurt, and the way that they express that hurt is through actions in which they had thought were normal or deemed acceptable or right. And in a lot of cases, this was deemed as right and okay in the past, but things have changed, and we have done a lot more study and research on trauma and our brains and who we are and what we take from our environment, and we are now able to recognize that a lot of these past teachings are no longer acceptable or necessary. So to be able to recognize that good people can do bad things has helped me a lot. And to recognize that transgenerational trauma has been passed down from so many generations, and it's hard to break that cycle. But one of the things that I truly believe can help break the cycle is not only acceptance, but understanding that you cannot control other people's responses or other people's actions. You can only control your responses to those actions or responses. So looking back to the conversations that I had had with these close people to me, I can now look at that and separate myself from their belief system and from their words, because that was their response to my upload, but it doesn't have to be my response. My response is the only thing that I can control in this situation, and so I have decided to respond in a manner of loving kindness and acceptance and growth. It's before we move on to breaking the cycle, I would like to continue back over to generational trauma and the genomes that are affected with trauma. So there is this very interesting article from science.com, and I absolutely love it. But before we get into it, I would like to talk about the fact that it uses animal testing. And I am not a fan of animal testing, as many of you know, but I would like to read this little excerpt here from Google that says, animal testing is still allowed in the US because federal laws require that non-human animal research occur to show the safety and efficacy of new treatments before any human research will be allowed to be conducted. So I understand that absolutely, but I want to move down this page where it says that the Federal Animal Welfare Act, the AWA, has been regulating animal research since 1966. The AWA excludes roughly 95% of the animals tested upon, such as rats, mice, birds, fish, and reptiles, and it provides only minimal protections for the rest. So that is very frustrating for me. I do understand it to an extent, but I believe there needs to be much heavier regulations on testing in general. But with that being said, now I can move on to this article, which, like I said, does include animal testing. So if you are uncomfortable with that, I totally understand. You can feel free to skip over to the next portion of the video. But I do want to show the ways in which our biology is affected through trauma. Fair warning, this is kind of a long article, but I feel it's important to go through most of it because it does have a lot of underlying information. So this states that the idea would have been laughed at 20 years ago, but today the hypothesis that an individual's experience might alter the cells and behavior of their children and grandchildren has become widely accepted. In animals, exposure to stress, cold, or high-fat diets has been shown to trigger metabolic changes in later generations, and small studies in humans exposed to traumatic conditions, among them the children of Holocaust survivors, suggest subtle biological and health changes in their children. The implications of this are profound. If our experiences can have consequences that reverberate to our children and to our children's children, that is a powerful argument against everything from smoking to immigration policies that split families. Michael Skinner, a biologist at the Washington State University in Pullman, his own research in animals suggests small changes to the epigenome, a swirl of biological factors that affect how genes are expressed. This can be passed down through multiple generations. If trauma can trigger such epigenetic changes in people, the alterations could serve as biomarkers to identify individuals at a greater risk for mental illness or other health issues, and as targets for interventions that might reverse that legacy. The idea that Mensway is exploring that not all inherited characteristics are rooted in DNA dates back more than half a century. Tantalizing early results came from maize, in which plants with identical DNA had variations in traits, such as kernel color, that persisted for hundreds of generations. The work was initially controversial, as geneticists saw it as a revival of the non-Darwinian ideas of the 19th century scientist John Baptiste, but experiments in many organisms suggested epigenetic inheritance was real. In simple creatures like the something worms, researchers found that genes turned off once by altering the RNA they produced remained in silence for 80 generations or more. Some examples were even more dramatic. Water fleas exposed to the scent of a predator have offspring with spiky, armored heads. And in mice, researchers, including Skinner, found that parents exposed to altered diets, low temperatures, or toxins had descendants with behavioral changes and weight gain. So this is saying that organisms, from corn all the way to worms to mice, if they were to experience something traumatic, that traumatic event is going to change their biology and therefore change the biology of their offspring. So epidemiological studies of people have revealed similar patterns. One of the best known cases is the Dutch hunger winter, a famine that gripped the Netherlands in the closing months of World War II. The children of women pregnant during the food shortages died earlier than peers born just before, and they had higher rates of obesity, diabetes, and schizophrenia. Studies of other groups suggested the children of parents who had starved early in life, even in the womb, had more heart disease. And a look last year at historical records showed that the sons of Civil War soldiers who had spent time as POWs, prisoners of war, were more likely to die earlier than the sons of their fellow veterans. But these human studies faced an obvious objection. The trauma could have been transmitted through parenting rather than through epigenetics. Something about the POW experience, for example, might have made those veterans poor fathers to the detriment of their sons' lives. The psychological impact of growing up with a parent who had starved as a child or survived the Holocaust could itself be enough to shape a child's behavior. Answering that objection is where the mouse models come in, and this is where we're going to start talking about the animal testing. So in 2001, Mansway began designing a mouse intervention that recreates some aspects of childhood trauma in humans. So this is pretty straightforward, but this is just saying that there is a very obvious objection towards the idea of the epigenome or biology being affected by survivors of traumatic events. And so they wanted to further that research to confirm whether or not it was just psychological or if it was actually biological. So now they're going to start testing on these mice. So she would separate mouse mothers from their pups at unpredictable intervals and further disrupts parenting by confining the mothers in tubes or dropping them in water, both stressful experiences for mice. When the mothers return to the cage and their pups, they are frantic and they are distracted. They often ignore the pups, compounding the stress of the separation on their offspring. Mansway says the mice's suffering has a purpose. We're applying a paradigm that is inspired by human conditions. We're doing it to gain understanding for better child health. Unsurprisingly, the pups of the stress mothers displayed altered behavior as adults, but to Mansway's surprise, the behavioral changes persisted in the offspring's offspring. Initially, she thought that this could be a result of the offspring's own behavior. Mice traumatized as pups could have been bad parents, replicating the neglect they experienced in childhood. Thus, they might simply be passing on a behavioral legacy, the same lasting psychological effect that might explain such findings in humans. So say John fought in the Civil War, and John parented his child, Adam, and John wasn't a very attentive father to Adam. And now Adam were to have children, and Adam would be traumatized from his traumatized father. So they're trying to decide if Adam's child is affected by Adam's traumatic coping skills or if it is biological. To rule that possibility out, Mansway studied only the male line, breeding untraumatized, naive female mice with traumatized males, and then removing the males from the mother cage so that their behavior did not impact the offspring. After weaning, she raised the mice in mixed groups to prevent litter mates from reinforcing each other's behaviors. So this is if Adam were to have a child with Becca, and Adam was taken completely out of the picture once the baby was born. So there's this baby now, and there's Becca, and they are together, and Becca is completely untraumatized parenting Adam's child. And this child winds up going to public school, and he is mixed in with groups of other children who are both traumatized and untraumatized, so that these behaviors aren't being reinforced. That is what they are doing with these mice, just to give you a better understanding of that. Her lab repeated the procedure, sometimes going out 6 generations, and it worked immediately. We could see that there were symptoms in descendants that were similar to the animals that were themselves separated. Descendants of the stressed fathers displayed more risk-taking behavior, like exploring exposed areas of a platform suspended off of the ground, and when dropped in water, they gave up and stopped swimming far sooner than the control mice, which is an indicator of depressive-like behavior in mice. So this was proof that trauma can biologically affect your descendants up to 6 generations down the line. And of course, this is in rats, not humans, but it's very hard to test this in a human capacity, as we can't really run test trials on humans in this way. And earlier in this episode, I had talked about an article that I had read that says that sperm and their genomes may be affected after experiencing trauma. Well, here is further in the same article talking about the sperm in mice. So, a woman named Bale found evidence that trauma can affect SNC RNAs in sperm, and that the effects might be transmitted to offspring. She stressed mice during adolescence by barraging them for weeks at unpredictable intervals, with things like fox odors, loud noises, and bright light. Then she examined the RNAs in their sperm and offspring. She found differences in 9 types of SNC RNAs, including one that regulates SIRT1, a gene that affects metabolism and cell growth. So this kind of goes back to the study where our brain's development is actually altered and disrupted if you go through a traumatic event. She then created RNA models with similar alterations and injected them into early stage embryos. When those embryos grew into adults, they carried RNA alterations like those seen in the sperm. The second generation also had lower levels of corticosterone, which is the mouse equivalent of cortisol, And after a stressful spell inside a tight tube, if you do the same RNA changes, you produce offspring with the same phenotype. So this is very biological. Trauma and generational trauma is real. It is biological and it is psychological, as well as it is physical, like we've talked about regression. So I'm jumping down this study now to another portion, which states, in a conceptually similar effort to go from mice to people, biologist Larry Feig at Tufts University in Boston exposed male mice to social stress by routinely changing their cage mates. The sperm had altered levels of specific SNC RNA groups, albeit different ones from those altered in Mansuet's mice, and their offspring were more anxious and less sociable than the offspring of unstressed parents. Working with a sperm bank, Feig then looked into the same SNC RNAs in human sperm. He also asked donors to fill out the Adverse Childhood Experience Questionnaire, the ACE, which asks about abusive or dysfunctional family history. The higher the men's ACE score, the more likely they were to have sperm SNC RNA profiles matching what Feig had seen in mice. Trauma is not only emotional, it is absolutely biological, and this is seen in many tests done on mice, but it is also seen on studies that people have conducted in humans as well, such as the offspring of Civil War soldiers or Holocaust survivors. But on this same topic, I can't help but wonder, how are we to break the cycle if it is biological? Of course, we're not going to be able to change our biology necessarily when we are trying to resolve our trauma, but we can absolutely do everything to help our physical and our mental state. So in my personal journey through trying to heal this generational trauma and break this cycle, I have come up with the 3 R's, and this might not be original, but it's something that I had thought of on my own, so please give credit where it's due if necessary. But my 3 R's for breaking the cycle would be recognize, reframe, and resolve or take action. So the first one is to recognize. So you have to be aware of the generational trauma, you have to understand it, and you have to be open to communicating with people to learn more about this trauma, where it comes from, how long has this been in the family, everything. It's very important to be aware. Otherwise, how are you supposed to understand it and then break that cycle if you're not aware of what is wrong in the first place? So the next is to reframe, and reframing for me has been monumentally helpful. It has changed my mindset in unimaginable ways. So to reframe my trauma, I try to look at the bigger picture, which is a DBT skill that I have not covered yet on this podcast. But it is to be able to see the positives in experiences that can be deemed negative, and to be able to pull the good out of all of those situations. So for example, in the last episode, I had talked about how I went through a horrible experience with close family members, but as traumatizing and negative as it felt in the moment, I was able to look back and pull the positives from that, and to be able to look at it and recognize that that experience is helping me to understand more about my family's generational trauma and how I can break that cycle. And lastly, resolve or take action. You can only take action once you both recognize and reframe. And in a sense, I believe that resolving and reframing are two in the same. I believe that being able to reframe your thinking in these experiences is taking action, absolutely. But how do we resolve this, and how do we break this cycle? I'm going to pull up another article from Psychology Today, and this says, here are some additional tips on how to break this cycle. So open up a conversation with your parents about their lived experiences and how they coped. But also keep in mind that your parents' lived experiences are far different from yours, and that the ways that they cope may not be the way that you can cope with your trauma. Notice any embedded patterns, attitudes, or narratives from your family that you continue to portray. For me, writing these things out helped a lot. If there were any negative parenting traits or thought processes that my parents or my grandparents hold, I want to write those things down, and I want to reflect upon those things and see if I reflect those ideas as well. And if I do, we can work to reframe those understandings and those opinions and change and get better and break that cycle. Talk through these areas with a trusted friend, family member, or a therapist, and consider an alternative way of coping or communicating, because a lot of times the way that we cope or communicate is very unhealthy and it doesn't work for us. So outsourcing is a very good option, and looking into different coping mechanisms or things that help others that are similar to you can absolutely be beneficial. Cultivate a sense of empathy and compassion for your family and the struggles that they have endured. This is what I was talking about with looking at the bigger picture. Despite their flaws, many of our ancestors worked hard so that we could have a better life. This too should be celebrated and embraced. But with that being said, it does not diminish or discredit your trauma whatsoever. Your trauma is your trauma, and it is okay to hurt over that trauma. But it also helps to look at the positives as well, and to use loving kindness, which is a DBT skill that I absolutely love, and it helps to create a more positive self and a more positive you. Next is to recreate a new narrative that you want your children to embody and believe about their family, themselves, and the world. And this goes along with reframing and resolving. That is both a resolution and a way to reframe your mind or your thinking. So with all of that being said, if you aren't aware of where this cycle had began or why it has continued or how it has impacted you and your family, you're not going to be able to fully understand the trauma, nor will you be able to understand why it is wrong, and you won't be able to heal and change. So moving on from generational and transgenerational trauma, I want to get into healing from trauma as a whole, not just from generational trauma. So I want to go into this extended transformational model, which is from tndfonline.com, and this shows the different stages of change and healing and growth in trauma and post-traumatic growth in addiction. But you can absolutely use this even if you haven't struggled with addiction, and you can absolutely use this even if you haven't dealt with or struggled with addiction before in your life. This is just a wonderful model that shows you the different stages in healing from trauma. So the first one that it has is pre-contemplation. So pre-contemplation is the individual is not thinking of change, having experienced no or minimal consequences to not changing. So this is before the awareness sets in, and this is before you are able to recognize that you have been through trauma or that you have negative coping skills that you use daily. And once you move out of that stage and you become aware, you go into the contemplation stage, which is the individual is aware of consequences and impact on life, but remains uncertain. They are engaged in progressive thinking towards change, but they require many setbacks to build a case for change. So this stage can also be looked at as a denial stage, where you recognize that there are problems, but you're not sure or not ready if you want to go through with getting better and getting help with these problems. And then there is the preparation stage, and this is where the individual has made a decision to change and starts planning steps to do so. And this is huge. This is a massive part of healing and growing and relieving yourself from these chains that trauma hold on you. And like I've stated numerous times, writing helps so much to just be able to write out what you are looking to gain from this experience and what you are looking to get better at and heal from. And from there, you can take those and you can put together a model of steps that you would like to take in order to overcome those things. The next one is action. The individual attempts new behaviors and interventions. However, they are not yet embedded. Stability and routine of new behavior is yet to be established. So this is what I was talking about with neural pathways in last episode. It takes time for these pathways to be embedded into our brains and for it to become natural to us and for these positive thinking patterns to become a part of ourselves, because we've been attached to these negative coping mechanisms or these negative thought processes for so long. It's really hard to gain that neuroplasticity back and switch over to the positive. And then lastly, we have maintenance. The individual's new behavior is established and stable in continued application to the long term. The positive change achieved justifies continued adoption and development of altered behavior. So this is when a person has truly recognized the trauma and they have recognized what they need to do to heal and grow, and these new neural pathways have been created, and they are able to innately think in a positive manner and have this innate growth mindset. We are going to move on to the following table now, which is the extended transformational model stages. Pre-trauma characteristics is of the first of 5 of these stages, and this is the belief system held by an individual that governs how they view their reality. So it is a very straight and narrow idea of what they believe, how they're going to view the world, etc., etc. The next is rumination, which is cognitive processing needed to gain meaning following a trauma. This can be intrusive or deliberate. So, for example, if someone were to struggle with addiction, which is what this transformation model is on, and they have trauma with this addiction, this rumination period can be intrusive and enforced upon them through intervention. So this is where they're starting to be cognizant of what they need to grow from this trauma. And then next we have event centrality. And this is the reference point from where future events will be viewed. This is the turning point in one's life. So when people talk about, for example, a spiritual experience which has opened their mind to the grand scheme of things, that is in and of itself an event centrality. It changes your viewpoints and it feels as though you're a new you and you can view life in a different way. Next is control, and this is an individual's adjustment after adversity, reasserting control over current events. So they are recognizing now that they had no control over the past or their past traumas, but they are recognizing that they can now adjust and they can conform and they can control what they have now in the present, and they don't have to be held down by that trauma any longer. And 5 is mastery. An individual's search for meaning, sense of control, and well-being following the restoration of control in their life. So this is finally realizing and recognizing that you and your brain are so powerful and that you aren't stuck in the past and you don't have to relive that trauma day in and day out. I'm going to also pull up table 3, which is just a combined model of all of these stages from both the trans-theoretical model and the extended transformational model. And this just shows the 5 different stages of both of those together. So pre-contemplation and pre-trauma characteristics, this says that the individual has a set of principles and behavior that they have yet to be challenged with any rigor. And this moves all the way down to maintenance or mastery, which the individual continues to practice and refine intended change, assimilating it into the everyday. So this is when you're finally able to understand that you are more than your trauma and you are more than your past and you are capable of growth and persistence, and you can do these things every day if you practice these things every day. But I do want to point out that there are a few things that can absolutely hold you back from recovering, and I think that it is very important to be aware of all of these things so that you don't fall into one of these habits or one of these ideals, because they are not helpful. They will only bring you back down and prevent you from growing. So one of the things is not knowing or understanding that recovery happens in stages. Like I had just stated, these are all stages of growth and all stages of recovery, and you can't expect it to be in the maintenance or mastery category of any of these stages right from the get-go. You have to be able to put in the work from stage 1 all the way up until stage 5 to master these things and to be fulfilled. Another one is comparing yourself to others. When I was first going through my self-discovery journey with my trauma, I was oftentimes comparing myself to others, and I felt as though it was almost a race and that there was a set time limit that I had to heal, and there absolutely isn't. I truly believe that if you give yourself a time limit, it is absolutely going to prolong the process of healing, and it is going to make it much more difficult, and it's going to hold you to standards that are not even necessary and standards that really aren't even there. Another thing that could hold you back from recovering is not investing your entire self. We have to remind ourselves that recovery involves everything, including the mind, the body, and the past, and the present, and the future. So you have to put all of those things together in order to recover fully and completely. So take care of your body, take care of your mind, take note of the past and recognize it as the past, and take note of the present and recognize it as now, and live in the now. So another thing is pessimism, and this could hold you back because you may believe that recovery is not possible for either yourself or for anyone, and that is absolutely not true, absolutely not the case. Anyone can heal, anyone can recover, and anyone can get better. Another huge thing that may be holding you back is not engaging in enough self-care and not being kind enough to yourself because of societal standards. And these societal standards might be telling you to move on or to just get over it and get on with your life. But the truth is that it is absolutely not that simple. It is not that easy. You can't just move on and forget about it, because if you do, you're just bottling it up and you're storing it in the back of your brain, and it's going to affect you every single day for the rest of your life until you decide that it is time to make a change. And lastly, you might be trying to take it on all alone. Outsourcing has helped me tremendously, whether that be to a therapist or a psychiatrist or to a doctor or a friend or a family member that you trust. Outsourcing is a positive. And speaking out about these things and communicating is a positive. Because without communicating these things, everyone's going to feel alone. Everyone's going to feel like they're in on this journey by themselves and no one else has ever gone through it because no one talks about it. So speak about it. Make yourself known. Let your story be heard. Tell people what you're going through and let them help you. Accept that help and embrace it with open arms. Because in the end, that will most likely be the unexpected help that you could ever receive. And just remember that there are people out there who can help you and there are sources. And I understand that a lot of people do not have access to mental health providers or the care that they truly need. And for that, it absolutely breaks my heart. But there are some resources out there that are available either over the phone or online, or if you reach out to your local community center, you can look into some free or nonprofit organizations that are there to help you because you're not alone. So many people go through this. So to end with how to heal from your trauma, there is absolutely no set way to do that. Of course, there are stages in which you recover, and there's no skipping over those stages or jumping from the first to the last. But healing from trauma is conceptual and it is different for everybody, and different things are going to help different people. So if you need to, I encourage you to look back at the different treatment options that are available for PTSD. And I also encourage you to write and to look into what you need to heal. It is so important to note that you should always take it one day at a time or even one step at a time, because looking into the future can only cloud your judgment and make you feel as though you aren't pushing yourself hard enough or you aren't getting far enough fast enough. And that's not the case. Healing happens in your own time, in your own way, and it is so specific to each individual. So what might help me to heal from my trauma may not help you whatsoever, but I truly hope that some of the things that I have talked about today have opened your mind to the possibilities and helped you to grow eager to heal from these events, and helped you to understand that you can heal from these events and that you are you. You are nobody else. There are no standards set for healing or for who you should be. You are exactly where you need to be right now, and you are doing exactly what you need to do. Have faith in the universe with that. So that is going to be everything for today's episode. Like I said, I hope you were able to gain some insight on trauma today, and I hope you were able to gain some insight on yourself and who you are and who you could possibly be in the future. If you are listening on Spotify, you can look me up on YouTube and watch the video there at the Higher Mind Podcast. And if you're watching on YouTube, go and listen on Spotify at the Higher Mind Podcast. You can also take a look at my website, which is www.thehighermind.org. I will put a link in the description below for all of these things. And on my website, you can sign up for our newsletter, which will send you updates about upcoming videos. Otherwise, you can sign up to become a member. And with this membership, you get access to exclusive content, as well as early access to content. And you gain entry into an exclusive discussion where we have over 15 different topics that you can discuss, ranging from cryptids to mental health, all the way to government conspiracy theories. I would highly, highly appreciate it if you would all take a moment to like, comment, or subscribe, or do all three, because you have no idea how much it helps me, and it helps to get my name out there, and it helps me to potentially heal others. And with all of that being said, take care, my friends, and until next time, thank you.